Like, I'm so excited to be starting something new today. This is my channel, Study Less with Marco. That's the purpose of my channel. My purpose of the channel is that for you to study less. I want you to. I know as medical students, you guys, you have a lot of things to study, and you have a lot of, oh god, it's like a lot of stuff being thrown at you. But that's why I want to start a channel to make things interesting, to motivate you, to encourage you to do a lot of things, to study less. Actually, I want to study less. So this channel is not just my topic. It's not just only on medical tutorial alone. We're going to have skits. We're going to have lifestyle talk. We're going to have motivation, how to read, because we have to know how to read, um, how to be motivated, how to continue striving to be the best and to be excellent. All those things are going to package, and it's going to be a total package. So I'm just going to start my introduction to anatomy. Let's start with anatomy. That's going to do biochemistry, physiology, and all that courses. See, you're going to enjoy it. You're going to see that this thing is not that hard. They're simple actually. But then you need to continue following my channel, subscribe, share, press the like button, and it's going to be wonderful. So let's dive into it. We're going to do introduction to anatomy. What is anatomy itself? Anatomy is from the word ana and tom. Ana means a part, and tom means to cut. While y, whenever you see y, it means study. You can just, it's safe to now say that anatomy is just the study of how things is cut, how things being cut apart. The another synonymous word for anatomy in Latin is called dissection. Actually, dissection is just does not give the total picture of anatomy. Dissection is just like, okay, cutting things up. Anatomy encompasses is talk more than cutting things up, but that's similar word in Latin, and in the English word means to cut apart. That's anatomy in English word. So in English word is cut apart, in Latin dissection, in Greek anatom. So that's where we got our anatomy from. Anatomy, and then let's quickly talk about how anatomy is studied. Anatomy can be studied in 3 ways. I'm trying to make this video as short as possible so that we can round it off. Anatomy is studied in 3 ways. The first way is regional anatomy. The second way is systemic, and the third way is applied. Regional anatomy is just study anatomy in section. Like, talk about the head, the neck. You want to study the head, so that's you choose a section for yourself that, okay, this is what I want to study. So you just study anatomy on the head, the neck, thorax, abdomen, upper limb, and lower limb. You want to study a section of the body. You want to concentrate on the section. That's what we call regional anatomy. Now, systemic is just, remember, we start from cell, then we move to tissue, and then we move to organ, and then we move to system. Actually, the study of cell of human beings is called embryology. Okay, study of tissue is histology. Okay, then study of system is part of gross anatomy. This one we are doing now is gross anatomy. I'm supposed to even talk about the difference between gross, embryology, histology, and all that. We're still going to go to that. So now we study gross anatomy again. Gross means large. Sometimes must have had gross misconduct. It doesn't mean that gross, it means large. Gross means large. So that means what you can see facially. So systemic anatomy, because you can't say you want to study cell under gross anatomy, because cell is not large enough, tissue itself is not large enough. You use microscope for tissue. The study of tissue is called histology. So you use microscope for that. Cell, you use microscope for it. But when you come to organ, you can see your organ. And when you talk of system, it's under gross anatomy. So gross anatomy can be studied based on regional, systemic, and applied. Now, going to applied, the reason for us studying all these things is for us to be able to apply it. So This is very useful for clinical students and doctors, medical practitioners and all that. It's very useful for them because they must know how to, especially surgeon must know how to, what to cut, how to cut, where not to cut. Not only that, even when I talk of palpation, osculation and all that, to be able to see somebody and examine that, oh, maybe somebody has a broken rib, there's a place you are going to touch, there's a landmark, like, okay, this is a landmark that when you touch this place, oh, you will know if the person has a broken rib or not. So that's the purpose of study anatomy. So we have bony landmark, we have body landmark, we have to know, okay, for example, now if you want to palpate the body, you know that, okay, you want to palpate, the artery of the body, you know that, okay, you go to where, you go to the upper third of your thigh. That's where you can feel your femoral artery. So anatomy is one that help us know that. So it's applied. You don't need to dissect somebody. You just need to, okay, this is where this artery is, this is where this vein is, this is what causes varicose vein, all those kind of stuff. So applied anatomy is very necessary. I think it's the most important among the three, but everything is also very, very important. Because if you don't know regional anatomy, you cannot know applied. If you don't see anatomy, you cannot know applied. So everything is important. So let's quickly go into, macroscopically go into regional anatomy. So regional anatomy, as I said, is choosing a part in the body and say this is what you want to study. So it can be studied based on one section. Can be studied based on section. Regional anatomy based on section. As this section can be head, neck, upper limb, lower limb, thorax, abdomen, pelvis and perineum. It's based on, you can study it based on section. Two, you can study it based on layers. Layers, when you talk of layers, you study based on, okay, from the external surface to the internal surface, like from the skin to the superficial fascia, from superficial fascia, or sometimes we call superficial fascia subcutaneous tissue, from superficial fascia to the deep fascia, from the deep fascia to the muscle, from the muscle to the bone or internal organ. So the third one is study based on surface anatomy. Surface anatomy. Surface anatomy is just studying the internal structure by examining the superficial structure. To study internal structure, like now, look at me, look at my hand. Now I'm touching, this is my hand, this is my radial nerve, this is my radial nerve fascia. You understand? So I'm sorry, this is my radius. My radial nerve is at my back here, sorry. This is my radius. So I can palpate here. I can check my pulse by pressing this place. So this is just surface anatomy. I can easily press my pulse by just checking a part of my body. So the anatomy is just examine the external surface. You can use stethoscope to osculate somebody's lung or heart to see how the person breathes and all that. So that's surface anatomy. The fourth one is radiographic anatomy. Radiographic anatomy. You can study it using, when you talk of radiographic anatomy, it's breaking down to maybe X-ray, and section imaging. So section imaging, X-ray and section imaging. Section imaging can be CT scan, MRI scan, ultrasound, radioisotope. So it's using that to study anatomy. So you can use these four aspects to study regional anatomy. So let's just look at layers. When we talk of layers, I'll draw something quickly for you. I call it onion tree. So now, sorry that I don't have a good triangle. I'm trying to be in a hurry because my time is fast spent. So this external aspect is called the skin. This is the skin. Can you see it? This is the skin. Now from here to here, this is the superficial fascia. Now this line, let me put it like this line is the deep fascia. Now from here to here, from this line to this line. Sorry, I don't want to be awkward. I'll draw it. Is the muzzle, and this one is the bone or internal structure. Internal structure. So we're just going to talk about these nerves move inside and outside. That moves from the inside to the outside. So we're just going to talk about all this. I've visited time. Thanks for following. I'm going to do more of these classes, and I really appreciate you guys. This is our boy Marco. Happy. Please recommend me, share, subscribe, send the link to people to know that there is another new video that is going viral now by Marco. Thanks so much for joining the class.